What's up everyone, Carl here, and in this video you are going to learn how to fix your lateral shift, which is often associated with lower back pain and sciatica. So if your hips don't align with your shoulders, chances are you've got lower back pain, possibly pain into the buttocks, pain down the legs, then this is the video for you. Let's do it. So how do you know if you've got a lateral shift? Well, it's fairly simple. Are your shoulders not stacking over your hips? If that's the case and you've got lower back pain, maybe pain into the buttocks or even down the back of the legs, then you're showing signs of sciatica as well. Chances are you have some sort of disc-related issue in that lower back. Now, if you've already tried an extension-based exercise and you haven't fix that lateral shift first, then chances are that's actually going to increase the amount of pain that you're suffering. So why do you have a lateral shift? Well, it's because your body has a defense mechanism. Your brain is detecting that there is a problem, probably coming from a disc that is impacting upon a nerve, and from that your brain is actually going to move your body away from that painful area. This is to increase the space and reduce the pressure on that symptom causing nerve. So if that's the case, what we need to do is actually correct the problem, restore that lateral shift, bring you back to that midline so you're nice and straight, so you can actually get on with the things that you want to do pain-free. So I am going to show you my two go-to exercises that I give to my clients that they can do at home regularly, which will give you relief in as little as 30 seconds. However, even after the pain is reduced, I advise my clients to continue regularly doing these exercises for upwards of a week. So what we're going to do first is a wall lean. This is taken from the Mckenzie Method. What we're going to do is stand sideways against a wall, or in my case, a door, as you can see here. We are going to stand 8 to 12 inches away from that wall, and what we're going to do is we're going to lean our good side, our pain-free side, towards the wall and allow our shoulder to touch the top of the wall, with our arm also touching it as we lean in. Now, you may have quite a long arm. What I'd like to do then is lift that shoulder upwards a little bit to make sure that your hip has space to move towards that wall or door. Now, what we need to do here is we are going to place our arm from the opposite side, so our pain side, onto our hip, and we are just going to slowly push and drive that hip towards the wall, moving towards the pain, so we're doing it nice and slowly to begin with. Now, once you begin to really get some resistance and pain that you can't move beyond, I want you to hold this for 2 to 5 seconds. We can then straighten up, relax, and repeat this exercise 10 to 15 times. So we'll be doing this in a nice steady rhythm, and we're going to get a little bit deeper into this exercise each and every time that we do it. Once we've completed this lateral shift exercise, we need to ensure that we move away from the wall without undoing all of our hard work previously. So we do this by bringing our good-sided foot towards the wall, standing up straight, and then moving away in one motion. If you're enjoying the content that I am creating, what you can do to help support me is hit that subscribe button, tap that like, let me know that this content is valuable to you. Now that we've restored that lateral shift slightly and we're more central as we stand and move around, there may still be pain there, but what we need to do now is actually encourage the extension exercise of that lumbar spine, which will reduce the amount of pressure and tension applied to the disc, which is actually affecting the nerve. So what we need to do is lay down on a nice flat surface. You can do this on the floor or a table as I'm doing it in this video. And to begin with, we can do this with a pillow underneath our hips and our stomach, just to make this a little bit more easy. Now, what we need to do is come up onto our elbows, and then we begin to keep our hips nice and firm to the table as we push upwards and backwards towards the ceiling with our upper chest, creating an arch or an extension through that lower back. Now again, like the first exercises, we are going to move into the pain but not push beyond it to begin with. We're going to hold it for 2 to 5 seconds and then we're going to come back down. We're going to repeat this in a nice rhythmic fashion, just like that first exercise. And what we're going to do is each time we extend backwards, we are actually going to go that little bit further. Now, with both of these exercises, what we're actually going to do is repeat them regularly, up to once every hour or once every 2 hours. And we're going to continue to do this even past the point of pain being reduced. Now, most of my clients, I advise them do this for up to a week and beyond. If your sciatic pain is still persisting after doing these exercises, then you're going to want to have a look at the piriformis. Now, this problematic muscle deserves a video all to itself, and that's why I have a video where I teach you how to stretch that problem muscle right there. Alternatively, this video might be exactly what you're looking for. And if you haven't already done so, hit the like button, tap subscribe, click on that bell icon, do all of those things, and I'll see you next time.